Hello, I'm Dr. Sarah Wasserbauer, and today on Here's the Question, we're going to talk to you about platelet-rich plasma, an injectable therapy for hair. Platelet-rich plasma is kind of experiencing a Wild West explosion in use. So a lot of people around the world have started to take a little bit of your blood, spin it down, take off the little tiny fraction of that blood that is the platelets, and re-inject it pretty much everywhere. They're injecting it in faces. That's the vampire facelift. They're injecting it in knees. They're injecting it in elbows, and they're injecting it in scalps to try and grow hair. And some of these therapies are really well established for their efficacy, and some of them are not. So unfortunately, hair is one of those things where it is still in the experimental phase. So a lot of practitioners are using it, and a lot of practitioners are getting good results. What you have to find is somebody who has really done a rigorous assessment of their own techniques and their own injecting styles. So you can't just assume that any practitioner who's going to be injecting platelet-rich plasma is going to be giving you what you really need. Sometimes they're injecting what's called platelet-poor plasma. Sometimes they're not injecting at the proper depth. So if you don't know for sure that they are doing platelet-rich plasma as it is needed to be done for hair, then do a little bit more research, maybe compare their data and ask for their data. That's definitely one way to do it. So here in my clinic in Walnut Creek, California, we have been doing platelet-rich plasma for quite a while, and here's what my data has shown. In 2017, we took all of the patients who were doing all of our platelet-rich plasma injections, and what we do in our office is we measure the cross-sectional diameter of the hair. In other words, we go to the same acre of your forest up here, and we go to the same acre each time, and we calculate, we take all the hairs in that acre, all the trees in that acre, we pull the bundle together, and we see how wide across is that bundle. So if that bundle over time gets wider, you know either one of two things is happening. Either you're getting more trees in that bundle, or the trees themselves are fatter, which is what you're looking for when you're trying to treat hair loss. So in our initial assessment in 2017, we took all of our patients, and we found that, and I set an arbitrary cutoff of about 10%, just to make sure that we were getting a real benefit. At that 10% cutoff, about 70% of our patients were getting an improvement, between 67 and 72. And for those patients, some of them were getting a 10% improvement, and some of them were getting 150% improvement. So you can see that there was a wide range in the efficacy. And let me tell you something more. Some of those 150% improvement patients would come back and say, wow, yeah, this really is working for me, Dr. Wasserbauer, and it still hasn't reached my goal for my hair. And some of those 10% improvement patients or 11% improvement patients would say, wow, this is amazing. This has done more for my hair than anything else. Let's just keep going with this. I don't need any more therapies. So it's not quite clear who's going to get what. For instance, I cannot, as a doctor, tell you that if you decide to do a platelet-rich plasma treatment at my clinic, we're going to get a 30% improvement. It's going to take 10 months to get there, and that you're going to have to do every 6-month injections thereafter. I can't tell you that quite yet because the data is not quite there. What I can tell you is that most treatments are going to take 6 months. Most treatments are going to work best on people who still have hair remaining in the area, and most treatments are going to require repeated injections and maintenance therapies over time. So if you are planning on doing platelet-rich plasma injections, if you're looking into it a little bit further, look for the practitioners who have really established themselves as being a PRP practitioner for hair, not just a wonderful orthopedist or your favorite dentist, but somebody who really knows what they're doing for hair, and do a little bit more investigating along those routes. Thank you so much.